negative impact of COVID-19 pandemic on people's health and livelihoods cannot be overstated. The pandemic has tested our resilience at a time when most of our communities are already stressed by climate change, economic slowdown, and in particular today, drought, which has left nearly 3.5 million people across the country food insecure. COVID-19 has also tested our health systems and our ability to deliver on our universal health aspirations. Most impacted are the vulnerable communities, especially in our rural areas and informal settlements in the urban centers. COVID-19 has been a wake-up call. Health promotion has been a driver for public health over the years and is critical in our work with vulnerable communities. I'm pleased that the measures that we have all instituted, both for infection prevention and control and vaccination, are working. We need to sustain our actions since we are not yet out of the woods. From the recent statistics on COVID-19 cases and fatality rate in Kenya, it is clear that vaccination is the solution for the society to get back to normal, in quotes, and for restrictions to be permanently eased. The vaccines are only one of the many tools we have to prevent infections and save lives. However, the right strategy is a comprehensive approach which will focus on addressing a number of issues. From the onset, Kenya Red Cross has been in the forefront supporting the Ministry of Health efforts to contain the spread of COVID-19 countrywide. We are currently supporting the rollout of vaccination in 35 counties, and with the support of Africa CDC, are also supporting 12 Red Cross Red Crescent societies in East Africa, the Horn of Africa, and Indian Ocean Islands. Kenya Red Cross has a robust community engagement component focused on addressing vaccine mistrust and misinformation, including vaccine demand and response to questions and prioritization criteria of the vaccine delivery. The organization is utilizing a combination of interventions, which include mass and social media campaigns, as well as training of 2,217 healthcare professionals, 476 media personnel, 988 community and religious leaders, 2,010 community health volunteers on risk communication and community engagement, as well as vaccine management. In 2020, we partnered with the Ministry of Health in the training of more than 70,000 community health volunteers across the country. While efforts to vaccinate our population have picked up, factors such as the drought in parts of the country and food insecurity, conflict, continue to impact vaccine uptake negatively. We continue to implement an integrated approach that allows us to respond to these emergencies while conducting vaccination drives. The Kenya Red Cross believes that understanding community perceptions is key to successful vaccination drives. For example, through the support of ECHO, we recently conducted a perception survey in collaboration with the Ministry of Health in 9 counties of Lamu, Turkana, Kitui, Samburu, Isiolo, Wajir, Mandera, Garissa, and Marsabit, where vaccine uptake is still low. The findings from this survey are now informing risk communication messaging by both the Ministry of Health and the Kenya Red Cross. And some of the findings from this survey include that there is good knowledge by the community on how and where to report adverse events after receiving vaccination. The knowledge on where to receive the vaccine is high in the community, and most preferred place is the government health facilities. The concern about getting COVID-19 and the worries in relation to COVID-19, however, have reduced among the community members, hence affecting vaccine uptake. This has majorly been contributed by the directive issued on use of masks, where 41% of the respondents indicated the directive is an indication that there is no COVID-19, which is false. The precautionary measures put in place by the government are regarded as important but difficult to keep. The community has not fully trusted the COVID-19 vaccine, its safety and importance. There are still information gaps on vaccine use by expectant and lactating mothers, where 30.4% respondents needed more clarification to help them make an informed decision about whether to get vaccinated against COVID-19. Some of the key recommendations from the survey include continuous engagement of influential community and religious leaders in risk communication and community engagement to improve vaccine uptake, creating demand and employing a mix of vaccine delivery mechanisms to target and reach key priority groups is an effective way to improve vaccine uptake and achieve greater equity in coverage. Strengthening and promoting an integrated systems approach means that services are more people-centered and are able to respond to health needs, which supports strong progress towards universal health coverage. It is often said that every crisis is also an opportunity. Coping with COVID-19 is indeed presenting some unexpected opportunities. Innovation, such as digital solutions that have been developed to ensure continuity of services, need to be adapted as long-term. As the COVID-19 crisis unfolds, there is need for evaluation, reflection, and learning from all the sectors: health experts, policymakers, scientists, and the population affected. Everyone needs to be involved at all stages of mitigation and responding to the pandemic. While crises routinely and periodically occur, the current COVID-19 crisis is of such scale that it highlights the need for an integrated approach encompassing health, organizational, social, political, financial, and ethical aspects. The information gathered from this experience will be critical to strengthen our response to future crises. Health promotion has much to offer to help people and communities cope with the COVID-19 crisis and its consequences. And the health promotion community can also benefit by learning a lot from this crisis. Thank you very much for your attention, and God bless you.